thank you very much for the participation in the poll. We will now move on to the webinar proper. For those of you who have got questions, feel free to key into the Q&A box at any time. We have catered some time at the end of the webinar to answer those questions. Our speaker today is somebody who is highly sought after by the media. He is a familiar face on TV as well as radio. You would have heard him over the last few months talking about infectious diseases and also how to protect ourselves better against COVID-19. So of course, we are talking about infectious diseases specialist, Dr. Leong Ho Nam. And without further ado, we will turn the time over to Dr. Leong to start the session. Dr. Leong, all yours.
Hi everyone. Yvonne, I must say I couldn't hear you for the last 5 minutes, but it doesn't matter. Okay, we're going to jump right into the slides, and this slides are actually helped prepared by EastMed, as well. I did some for myself, and I'm going to share them here with you now. Okay. Good. Now, I'm going to speak honestly. The amount of information you get here is actually on the website. It's quite freely available. And at certain places which I find important, you'll find a QR code. Feel free to take a shot of the QR code so you know where you can get the information. And in truth, there's a lot of information out there on what you can do and what you should not do for your business. And in truth, a lot of common sense is needed. We had lunch today at one of the nice Chinese dim sum restaurants, but unfortunately, what didn't fall through was actually practicality and common sense. There was a lot of obeying the rules that just paralyzed the company. Now, what I want to show you is just some of the business considerations. I think more important than the talk will be the questions. Feel free to ask anything there is about the safe business reopening and how to protect yourself and how to protect your staff. I'm very, very heartened that cost consideration wasn't the first number one factor. Everyone was more interested in the safety of your work, of your colleagues and your staff. To me, that's very heartwarming. Okay, I'm going to start by going through. You see, this was taken off today online. I came up with this slide yesterday, and this was for the day before, which was on Monday. So what happens is Marina Bay Sands Casino was one of the places visited by COVID-19 cases while infectious. Now, the good thing is, compared to last month, the moment one case has been identified, the place will close up and you actually sterilize the whole place. And you can spend tens of thousands of dollars to do it. But now companies are still allowed to continue because you're expected to have certain procedures in place to look after your staff and look after your workplace. So the idea is actually to have business continuity. If you're not prepared for COVID-19, you're not prepared for your business to continue on, and that will be a big issue. So if you look at this, Casino Bay Sands, the Little Mall as places visited, think of your own company, think of your own mall, think of your own shop putting down there on the newspaper. Could your company be at risk? Now I'm going to touch a little bit of few things, WHO and MOM considerations as well as requirement. We'll look into the PPE overview, and we could talk about surgical masks, respirators, etc. And I'm going to go into a little bit more details on a more personal take about safe business reopening thereafter. Now, guidelines already exist, and they are honestly very, very, very exhaustive. Your WHO guidelines and MOM guidelines. Where there are no guidelines and you need questions on that, then I would suggest you use a little bit of common sense. And the common sense will be something which you understand with the WHO guidelines and MOM guidelines that comes along. This QR code will take you to the WHO website where they talk about the public health and social measures which are needed at workplace in the context of COVID-19. You can scan it and then read this, and then there's actually a checklist on the different things which you ought to have. Now, the key salient points is actually a few things that of hand hygiene. Hand hygiene means having to wash your hands. Now, we don't like soap and water because it makes a queue, it makes it wet, and then it takes a longer time to process it. But we like alcohol-based hand rubs, and then there are probably many, many different things and different solutions to it, including the solution distributed by Temasek at the very beginning. Now, but I would rather go back to alcohol hand-based rubs and then think about hand hygiene stations at your workplace and then hand rub dispensers. Respiratory hygiene is very, very important. And this means having to put on a mask and covering your face. Now, respiratory hygiene, one issue which people have is they have the mask, but they don't wear it correctly. You don't wear it correctly, you don't have the protection. The second thing is when you speak, please remember to have the mask on. But for people who really shout through with large breathing movements and speaking loudly, sometimes the fumes can come out through the sides of the mask. You should talk in such a way that the speech with the voice and the air goes through the mask, and this will protect the other party. And I'm going to be very frank and honest with you. The mask is not 100% protective. It cannot be. There's no such thing. But it will filter most of the stuff that comes out by at least 95%. If I were to wear a mask and the person next to me that breathes in the air that wears a mask, you have another 95% efficacy. You're talking about very, very good effectiveness in preventing transmission. So hence, respiratory hygiene is not just about me wearing a mask, but everybody wearing a mask. And if you need to talk, please wear it with a mask. And you realize that when you take off the mask, it flies. You may have read on the news recently about airborne, the virus being airborne. In truth, any virus can be made airborne in the right circumstances. As I speak, droplets will fly out. But as it travels in the dry, humid air in winter Melbourne now, for example, the air particle droplets will shrink in size. And when it shrinks in size, it becomes lighter, and then it tends to float in the cold air in Melbourne better. This in turn encourages transmission. So respiratory hygiene, when you actually put on a surgical mask, you're going to prevent some of it. But in truth, for airborne transmission, you need the N95. People might ask you, why don't you wear N95? The answer is that compliance to N95 is terrible. The mask is very, very uncomfortable, and to wear it and you breathe in, the oxygen which you're getting onto your fingers and your body actually falls a little bit. If you have bad lungs, your oxygen actually falls significantly, and you can actually get breathlessness just with wearing a mask. And then physical distancing cannot be emphasized again and again sufficiently. So WHO asks for 1 meter. My preference is 2 meters, because if I shout or if I cough, my droplets will fly 2 meters. But if you think about the concept of airborne, then certainly the further distance you are, the better. Now, whenever I am, I want to try to reduce the density of the people in the building and minimize the need for physical meetings, which means that though we are in the same building, we should just try to talk over the phone or use a web call or something like what we're doing now, do a Zoom call. Don't overcrowd and then try to do split teams arrangements and then teleworking, again, to keep people away. Mask helps so much. Keeping the distance helps even more. Now, work-related travels, of course, if the person can stay at home, don't come and work, that'll be even better. In terms of travel, we are actually not doing so much travel nowadays compared to last time. Regular environmental cleaning and disinfection. This is very straightforward. Keep your office clean. You still need your cleaners to come in and use the appropriate detergent. The best thing to do, what detergent to use, look at NEA, straightforward and fine. If the surface, for example, on the table, which you can see down here, that's fine. Surfaces like that are quite a little bit harsh for the viruses. But if the surface is dirty, contaminated with organic material, the virus will survive on the surfaces better. And we mustn't think just of viruses, we think of resistant bacteria as well. Keeping the table free from organic material helps in preventing transmission. Risk communication, training, and education. Uh, the honestly, the Ministry of Manpower does it quite well and pushes on this information to engage workers, the foreign workers, etc. I have a chance to look after foreign workers who have COVID-19, and there are courses and information which they have to go through, which is in their own languages, so they understand about safe distancing, etc. My beef, however, is this information is shared, but no one actually practices it. So it's only as good as how good is practice. Management of people with COVID-19 and their contacts. I hope this doesn't happen to you. I hope the numbers remain small and your office is safe and clean, safe and healthy. But if someone who is unwell, who develops fever, cough, etc., please stay at home, self-isolate. In fact, we should have the concept and the idea is the moment you're unwell, don't come into the workplace. Get yourself sorted out, show that you're well before you go back in. And for the record, currently, if you have fever, you feel unwell, you are still more likely to get dengue fever now than to get COVID-19. So don't worry, get yourself sorted out. It might just be you have been bitten by the mosquito bug instead. Now, MOM has a similar workplace safe management measures as well. Here's a QR code which you can try to screen. You can go there yourself and check on it. Some of the measures which are done are very straightforward. And the idea is actually keeping your workers safe, your workplace safe, and basically getting your companies to continue to work on. A few things is about taking care of your workers. This would mean actively try to keep your employees safe from the illness by working from home. Stagger work and break hours. You could be as simple as coming in at different hours so that you use the office at this time, or use the office at the other time, or split part of the offices. You work by shift team or split teams. And at the end, it is very important to continue to wear masks at the workplace. Employers must ensure that there's sufficient masks for all employees. And certainly we're not in January, February, when masks was more expensive than a total ticket. Take care of your workplace. The visitors who come in must be logged in, and the travel advisories are very clear and straight, obvious. Physical distancing, keep at least 1 meter. If you can, my challenge is to do better than the government. Push for 2 meters. I know it's difficult, but if there's space, if there's availability, when you talk, even go for 2 meters, that's better. Minimize the need for physical touch, step out cleaning, etc. Very obvious, keep the cleaning and disinfectant agents at the usual places. Workers who are sick do not come into workplace. Now, I would like people, if you can actually do your own temperature charting, check up your own respiratory symptoms. In fact, make it a point that the workers are not penalized if they report in sick. Because if the person turns out to have COVID-19 and comes into the clinic or comes into the workplace, in your case, you can actually bomb the whole office and your business will suffer as a result. So monitor employees, make sure they check the temperatures and actively monitor those who are unwell. Find out how they're doing. Did they go for a swab? Did we get a diagnosis? Did the symptoms recover? The symptoms which I'm quite worried about in COVID-19 will actually be fever, cough, or the loss of sense of smell. You have any of the three, I'll be a little bit more cautious. Confirmed cases, if it happens, send them some food, send them some flowers, look after them. Safe management measures, there's such a thing as a safe management officer as well. There's actually a course open for safe management officers, but it's meant more for the construction industry. If you have enough workers and you need to manage them, please think about getting them to go on the safe management officer course. Now you see a young handsome bloke here who's totally gowned up with the PPE. He has with him the face shield. He has with him the a surgical face mask. Not face. He has himself a face mask. He has himself a face shield. He has himself gowns, and he has with him nitrile gloves. So he's actually quite well protected. If he goes voting like this with GE 2020, he is very well covered. He wouldn't pick up anything. Okay, so I'm going to talk a little bit about PPE and what's needed and what's not needed and what should I wear. And I'm going to go through some of the equipment that's available. Okay, and whether all surgical masks are the same or not. Okay, so this is quite a lot of protective equipment, and I'm going to show you one by one. I'm going to shut off this one, and I'm going to get the information all the screen all to myself. Okay, I think this is a great invention. This is a forehead temperature scanner, but before you use one, please check that the data and specifications are all right. And then when you get it, the best thing to do is to check yourself. What does it say for me? It says I'm 36.6. That's cool. If a reading reads it off as 32 degrees Celsius, you either check whether you are alive or you throw away the thermometer. So make sure that the thermometer is working quite well. Number two, check it against your own oral thermometer as well, or the ear thermometer, which is either one. Check the differences between the two. You'll realize that this forehead thermometer is about 0.5 or even 0.7 degrees Celsius lower than the ear probe or the oral temperature. Which means if you are going to use this to scan people, if their temperature is reading of 37.0, 37.2, you cannot take it as a pass. Any temperature of 37 and above, I would suggest you use the ear thermometer to double check, because the reading from this machine is slightly lower of about 0.5 degrees to 0.7 degrees lower than that of the ear thermometer. Anything who reads 37.2 should be checked with a ear thermometer. Okay, I'm just going to check my temperature again before I go off. Does it read well? Yeah, 36.6. Good. I'm happy. I'm still alive. Okay, the next thing which I have here is actually a pair of eye goggles. Now, some people love it, but I honestly hate it. You kind of put it on and you wear this. This is quite a nice design because there's actually allows a little bit of air to come through, allow the misting to come out, but it doesn't allow the droplets to come in through the eyes. So this is great. Otherwise, your eyes can fog up. When your lenses are fogged up, when your glasses are fogged up, the worst thing that can happen is the person will use this to adjust. Now, I don't like this in general. I don't like this in general because it's rather uncomfortable. But instead, what I would do is actually to use a face shield. A face shield, you can strap it over the head like this. This is very comfortable. You have a surgical mask, you have this on, you are actually very, very well covered. If you might see it on the web where people have come up with hair bands to try to clip it on, but honestly, this is quite decent because you can do this and put it down again and you can talk freely. You realize that when you have the face mask on, your voice gets very muffled. You put this up, you can talk to the person very quickly to understand some things and put it down again. So this is actually very decent. We have with me here actually a surgical mask, something which all of us are very, very familiar with. Again, there's a metal edge. You need to decide where's the front and where's the back. Obviously, this is the front. When you open it up, it opens up nicely. You can see that it doesn't trap anything behind. Some cases, the masks are all white in color. You don't open up this way where debris can catch into the pockets down here. Now, surgical mask, everyone has it, everyone wears it. The WHO actually recommends the surgical mask to be used for not more than 6 to 8 hours. Now, I'm okay if you want to continue using it, but please be very careful. If it's wet, it doesn't work anymore. If before you use it or you use it, do a manual check of the integrity of it and check that it's fine. And when you put it on, make sure that the loops are in place. And number three, breathe in and out through the mask. You should feel that the mask air is coming in through the center and not by the sides. If it comes in through the sides, it's not very good. Now, one reason why EaseMed approached me earlier on, I'm going to be clear and completely honest to you. And for the record, I'm not getting any honorarium. I'm not getting paid for this talk. Okay, if you want to protest, you can protest the EaseMed after this. But coming back, they have a surgical mask here. Sorry, this is actually an N95 mask, which is a little bit different from the 3M mask, which you're familiar with. It's called Nask, N-A-S-K. We can see it from the screen. It's actually remarkably soft and remarkably comfortable. It's actually N95 certified, and if you put it on, it opposes to the face cheek and the face mask very, very well, very comfortable. Now, if you try wearing the N95 mask by 3M, my criticism of it is that I will get acne all around my mouth thereafter. It's very uncomfortable and you need to scratch yourself. But when I use on this N95 mask, it's fine. It is actually certified by NIOSH. It is N95 certified, which is good enough for my healthcare wear. Number two, you can actually fold it quite nicely so it doesn't take up too much space, which is simply great for my clinic. I cannot have the whole clinic filled up with N95 masks. If you can, try this on. I do strongly recommend it. Again, I'll stress you, I'm not getting paid for this talk. You wear it, it's really fantastic. I've given out 3M because this is a lot more comfortable. Okay, now I'm going to move back to the gowns a little bit. I'm going to share screen again. You have the isolation gowns, which you see on the bottom right hand of this screen. I'm not going to show it to you in person. Each gown should only be used once, and once it's contaminated, you should discard it. You should only wear this if people are sick, people are not well. But in the context of screening at the center, at the front of your mall, or your front of your office, you don't really need to do this. Unless you know the person is sick, he has a fever, he's not feeling well. Wearing this gown is not exactly comfortable. Many people may actually sweat in it. And when you wear this, a lot of people would inadvertently go around doing other things. So if this gown is contaminated, you can imagine going around to other places, contaminating other areas. So for those who actually wear this isolation gown, please wear it only at the screening centers or place which you have to. Again, most screening centers do not need to wear the gown. Healthcare workers are different. When we go into the room with COVID-19, we need to do so. If you're not using it and you want to reuse it, you can. I would suggest at least change the gown at least once a day. Number two, take it off very carefully. And in between taking off your gowns or touching anything, wash your hands. You can actually use a hanger and hang it up with the gown facing inside, okay, inside of the wall, so that anyone who comes across will only encounter the back of the gown and is much safer. Okay, so this is what a healthcare personnel supposed to wear, and this is the kind of outfit I would wear when I go into and seeing a patient with COVID-19. In our case, we wear the N95 mask, which is one on the left, which you see my cursor pointing now. Now, an acceptable alternative in the case of non-healthcare worker situation, wearing a face mask will be fine. I think in GE 2020, everyone saw a lot of the election department people were wearing the surgical face shield. Then they all went on to wear a surgical face mask. So that's fine because the risk is considered as low. In high-risk area, we actually prefer to use the N95 mask as the picture on the left. Okay, this is a World Health Organization. If you're obsessed with numbers, you're obsessed with standards, go down to this website where you can have the different standards for the different kind of protective equipment there may be. I'm going to show this slide. It is extremely busy site. You are not supposed to read it. It's just to show you how technical all this information can be. In terms of face shield, fit test kits, mask, medical, scrubs, etc. They have all different classes and all different forms of certifications. My recommendations is don't bother. If you what you really need to know is actually your face mask. It's because face mask is extremely important. You need to have your standards. You need to make sure that your information is what you're getting is the real stuff. Um, the thermometers, get a good reliable one, pay for a good one, and use it. And once in a while, check against the home thermometer which you have and see the difference. It should not be more than zero 0.5 to 0.7. If you are reading a temperature of 32 degrees Celsius, which has happened as I enter into a shopping mall, I can assure the shopping mall that I'm not dead. If I'm not dead, your thermometer must surely be dead. So be careful of that. So I will focus very much on the surgical mask or the N95 mask and the thermometer. The rest of them, in terms of the gloves, in terms of the gowns, I will not bother too much about the standards because they are mostly all right. But I'm very, very obsessed with the surgical mask. Again, multiple standards for different equipment, even for gloves, for example. There are so many standards, it's quite confusing. Surgical mask, as what you see here, very straightforward, very easily understood. In fact, many people would have it in their house. But in March and April, I saw people coming to me with masks as if it was just a translucent sheet of plastics. What happened was the person bought a box of masks and what you have is only the outer layer without the inner filtration. You see, people get conned and people can actually put standards on the boxes without any form of verifiable data. So on this note, you can see that many people actually will end up with the delivery of very poor quality Chinese masks. And even USA, they weren't preparing for masks when we were struggling with COVID-19 in January and February. Finally, when they wanted masks, they imported a lot of masks. But at the end of the day, they don't block the virus particles. They are actually putting healthcare workers at risk. This comes from the Straits Times itself. China tak boleh tahan, even took off the mask and took them off. What I understood from one of the other big conglomerates, medical conglomerates, all Chinese masks now are not supposed to put up the standards because the Chinese are really very terrified that they are blamed for lousy masks thereafter. But what it means is that you have to make a bit of effort to buy the mask. I would actually spend a bit of money to buy a good mask instead of something which I can get from the gas station or that's uncertified. Number three, if you have a good mask, you have a good protection. There was a article that was done. It was either Straits Times or Channel News Asia, where they look at the different masks that were available somewhere in March. At the end of the day, many of them failed. The ones which actually were distributed by the Jinghu, the government, was actually quite decent. So I would rely on medical suppliers for my mask rather than what I find from Watson's or 7-Eleven. Masks, are they all the same? There's actually classification. You have the American group and the European group, and they talk about the different levels of safety and they talk about the barriers, effectiveness. I'm going to spend a little bit of time explaining to you about BFE as well as VFE. BFE actually stands for Bacterial Filtration Efficiency. Now, it means that 95% of the time, the bacteria will be blocked off. Now, what they do is they use bacteria, they shrink it, and then they deliver the bacteria out at about 3 microns. Very, very, very small. The airborne particles which we are talking about is less than 5 microns, and the droplets which we are talking about is between 5 to 10. Now, if you have a bacterial filtration efficacy of more than 95%, it will be fine. But you're going to ask me, Honam, we're talking about virus here. Coronavirus is a virus, it's not a bacteria. Why shouldn't we use a VFE? The answer, it is more technically difficult to do VFE compared to BFE. BFE uses a common bacteria such as Staphylococcus aureus, which is found in labs, which can be purified very easily. In VFE, you actually use a bacteriophage, which is harder to come by, more specialized, making the testing more difficult. Whereas BFE is very easily tested. But if you are BFE more than 95%, chances are you're going to be VFE more than 95%. Because similarly, for both bacterial filtration efficacy and viral filtration efficacy, you use the same particle size number. So that is good enough. Now, you also see something called Pfe efficiency. This is when they look at particles, dust, and debris instead of bacteria. So when they say that the Pfe is more than 95%, you're talking about N95, where the particle size are 0.1 to 0.3 microns. Now, the air droplets is slightly less than 5 microns. So if you are N95 well covered, you are very, very well covered and effective for the prevention of airborne diseases with COVID-19. Now, masks can be in terms of the EN European standards or can be ASTM, which the US standards. Both to me are very similar. Some people go for both standards, some people only go for one standard. But if you see the standard and you see the certification of it, I'll be very, very happy. Breathability, very important. As you put on the mask, how well is it easy to breathe? In some cases, putting on the mask makes it difficult. And don't wear the mask and run. Apparently, one of my colleagues actually told me someone developed a heart attack while putting on a mask and cycling. So don't do that. It's not worth it. But once you finish cycling, put on the mask. When you put on the mask, you restrict the amount of oxygen going in somewhat, and in turn, this will affect your heart. This will be a stressor for your heart. Okay. So lab tests and regulatory certificates are recognized with established approval bodies, one of which is actually Nelson Labs. It's very, very well recognized. You for my own company, for my own clinic, I insist on actually certified masks. I do not like to buy something that's fly by night. Certainly my clinic is not fly by night. I want something that's reliable for my staff. Regulatory, CE, FDA marks, ask for certificates to show that they are fine, and then check on the supplier. You don't want a fly by night supplier, and make sure it's all legitimate. Okay, so these are some of the things where you actually have a Nelson lab where they talk about the bacterial filtration efficacy and the pressures, etc. Okay, here you have the bacterial filtration efficiency of more than 98%. The breathability down here is less than 40% Pascal, and the particle filtration efficacy is more than 98%. Okay, respirators are a little bit different from surgical masks. Respirators will be the N95, which I'm familiar with. On the right-hand side of the screen, you see the Nask Mask, which is down here. Again, I really like it very much. I must tell you, I'm addicted to this mask. I've skipped the 3M N95. I use this for all my work now. It looks a little bit firm on the picture, but in truth, it's very flimsy. And I must say my acne kind of didn't appear when I started using the Nask Mask. Nask Mask is actually a relatively new brand. You can Google search NASK and you realize that it uses the nanoparticle technology that prevents the growth of bacteria. Now, as the air goes in through the mask, it goes in quite easily. It goes in quite easily and smoothly. Any bacteria that's trapped inside there will die. There's a very nifty YouTube video on it, which you can see. Now, on the right side of the mask, you would actually see a mask fit. If you want the N95 to be worth its grain, worth its weight in gold, then you would actually need to be mask fitted. Medical healthcare workers like myself have gone through mask fitting. Then we know what sort of mask will fit for us. Now, the problem with the 3M masks is the ones which you have, they're all rather firm shaped, which means that it doesn't cling on to the face of the cheek well, and it doesn't fit everybody. There's some, an Asian's face being a little bit flatter, it doesn't work very well. So if you really want to be very dogmatic about it, you need to be mask fitted where they use different scents to test and make sure that it works well. So respiratory test requirements for the N95, your particle size tested is about 0.1 to 0.3 micrometers. For the Nask Mask, they actually use 0.1, and the particle filtration efficacy is more than 95%. With this, no TB, no chickenpox, no measles, and certainly no coronavirus will be able to enter it. And thankfully, it's not suffocating like the 3M mask. So the NIOSH N95 is actually NIOSH, which is a standard, uses nanofiber technology, is designed by Asians for Asians, and inside there's actually a layer of chemical that will kill bacteria in 5 minutes. As you breathe it in, if the bacteria is stuck there, it actually dies. So what I like about it is, in the peacetime, let's say COVID-19 is over, and you will go and visit someone who has poor immunity, or someone who's poor immunity and wants a mask, you can bless them with this mask because it's going to cut down the bacterial risk. Okay, again, these are more certifications which will tell you that different masks can be credentialed properly with certificates. Okay, this is just to show you that these certificates may be asked upon recommendation. Okay, I'm going to come to the conclusion part here now. I think we are in a very special times. The last time something like this happened was in 1918 Spanish flu. If you are still alive now, that means you are born before 1918. I'm very pleased with you. I'm very pleased for you, but you're probably more than 100 years old. COVID-19 can actually wreck our whole business. COVID-19 can actually destroy the whole business. And honestly, our business is at risk. I'm going to say something that's very unkind. I expect the numbers of COVID-19 cases to go up, surely and definitely. I've said it to the press, it will be surprising, it will be a miracle if we don't have another spike in cases. You look at Hong Kong, 0 cases for weeks, suddenly they have a huge spike of more than 100 cases, and they're limiting people to 4 persons. And this is a country where the culture, mass culture is fabulous. Look at Beijing, where they screen 11 million people screened in 1 week. Singapore can't even screen 400,000 workers in 2-3 months. And with that kind of determination, that kind of equipment, Beijing still had cases coming through. If they fail, and even Korea that uses geolocation fails, I can assure you Singapore, with our leaky immigration, and with the way we wear our masks, we're going to have more and more cases. At the end of the day, please don't count on the government to look after your business. We have to look after our business ourselves. And to look after our business ourselves, we have to look after our own people, our own staff. It means giving them good equipment, reinforcing them care again, and reinforcing that their health is your business health. If they are well looked after, your business is well looked after. So everyone, please be prepared. There will be another spike. We might even go back to phase 1. I don't know. I don't want to go back to phase 1. I want business as usual, but mask up continually with distance maintained so everyone can have their business running, their revenue going. Business at risk, please look after yourself, get good mask and good cover. Think about where it's getting face shield for your frontline staff, if not a glass shield or perspex shield so that your people can work safely without any risk. You consider goggles too. I have nurses who swears by goggles more than they swear by face shield. Each to each their own like. One man's meat is another man's poison. Use different measures there are. Administrative engineering. Think out of the box. If you can think of something more incredible that will save your business, save others, start it. Even talk to EastMed, share it, or start a business on it. Equipment available. There are varying standards available. Choose good ones, credentialed ones. You are here to stay. You're not going to fly by night like the rest of the company. Very importantly, choosing your right equipment is extremely important. Okay, I think I come to the end of the slides. We're down to question and answers. Please ask Leong anything. Okay, we have Yvonne there that's dying to take questions. Ask me anything and we will go ahead.
Yes, thank you, Dr. Leong. That was really very insightful. We have got quite a number of questions that have already come in. All right, yeah, so we have the first questions who coming in now, who is a volunteer manager. He is asking in engaging our beneficiaries during door-to-door visits or distribution of care packs. He would like to ask what kind of PPE would be suitable for the volunteers who are going door-to-door. And they are following the guidelines issued in contact time with the beneficiaries. So I assume there's less than 15 or 30 minutes.
Yeah, it'll be less than 30 minutes.
Yeah.
Michael, I am extremely proud of you. I love the volunteering spirit. Please keep it up. Now, you need to think about what you have to do. If you are going to the beneficiaries, literally just door to door, and you are going to have just a short time of exposure, you're not going to go into the house. What you need for yourself is a good surgical mask, and I will use a face shield for myself. We got a surgical mask and face shield. I don't come in contact with the individual. I don't enter into the rooms. That is adequate. If you want, that's number one. The second layer which you need to have is either the hand wash alcohol rubs which you bring along with you, or second thing is you wear gloves. Now I don't like gloves because you can imagine that I'll wear the same pair of gloves like the GE 2020. You go and visit every single home. You bring the same pair of gloves, touch every door handle there is. What I would rather do is to bring a spray of alcohol. If someone who's next to me, I would wash my hands, go and talk to the person, explain the stuff. As I finish with this house, I'll spray my hands with water and alcohol and I'll move on. Because if I were to wear gloves, then what you have to do technically is to take off the gloves for each and every situation. Third thing, do I need a case of PPE? Most of the time, no, especially if you don't go into the house. But for doctors and nurses who do home visits for patients, they will need to wear a PPE when they enter. If you do go into the house for a brief moment and you do not sit down anywhere and you maintain a 2-meter distance, it is fine to go in without PPE. But remember, the moment you sit down, you need a PPE. The moment you touch something with your clothes, you need a PPE. And they may offer you a drink. Don't drink it, okay? Don't drink it. Say thank you very much. You do a cheers this way, imaginary drink, and that's it. Please don't drink the water. Do what you have to do and come out. Best thing, maintain at least a 1 to 2 meter distance. Mask, eye face shield, that's great. You don't need a PPE if you are not going into the house.
All right, great. Thanks, Dr. Leong. There's another question from Eugene who is asking, would you advocate for reception staff to don N95 regardless of, regardless of whether they are from a medical institution or otherwise, for reception staff?
Eugene, I think that's a very good question. I like it because it is really the real situation. If you love your staff and you want them to wear an N95, I think it's fine. When you actually wear an N95 and the person like me, read too many books that kind of wear glasses one, that's great because you actually have some form of good protection. They are very well protected. My issue, however, is how comfortable are they? If you have a comfortable N95, you have a face shield, and the person is happy to go on hours like this, 1 hour, 2 hours like this, by all means, go ahead. I think you are showing love to your staff. I think that's excellent. But I can tell you honestly, for someone who's healthcare trainer, you ask me to wear the N95 for half an hour to 1 hour, I will cry, Father. Okay, I won't say the next word. I'll be very, very upset. So it's really very uncomfortable. Now, so it's fine to wear N95. If you really want to offer them N95, uh, this one is almost, sorry, it sounds very crude. It's almost as soft as the underwear. So it's really quite comfortable. Get one, try for yourself. If your staff likes it, give it to them. If they don't like it, they cannot bear with it, then just give them the surgical mask. Is good. But get one that's rated and you will be fine.
Okay. Next question, Dr. Leong, what is your recommendation for the pharmaceutical industry sales team? And this question is from Jason.
Jason, I want to know which company are you working for? Okay, industry sales team. Again, I'm not, okay, I would just use a surgical mask at least. Surgical mask at least. I would may and may not want to wear a face shield. Okay, I'm neutral with that. But when I go in, when I actually engage the people, I will want them to wear a mask. Sorry, I want a surgical mask, and that's about it. I'll talk to them, but yet at the same time maintaining my distance. Okay, you can't see this, but on my right hand side, I've got two handsome men here who are maintaining their 2 meter distance away from me. Okay, so communications can still happen, maintaining a distance with the surgical mask, and that's adequate. And you must remember to do your log in and log out secure check-in. And we'll do our part with the Trace Together app. With all these, I think that's adequate. There's no need for gown. You can wear wear additional face shield if you want, but sometimes the person can't hear, so you lift up a little bit so that the voice goes through. Okay, otherwise it's just literally a pretty face visiting the doctors or but the information doesn't go across.
Okay. The next two questions is actually pertaining to office staff. We have Doris as well as SN who is asking what is the PPE that is required for office environment, and also whether the reusable mask that is given out by the government and Temasek, are they effective in case of any confirmed case for office staff?
Okay, the PPE in the office environment, if you are not going to do any screening, and all those people are supposed to be healthy with no fever, etc., I would just need a surgical mask. If you want to be kiasu, then put on a face shield as well. Put on a face shield and surgical mask, the chance of you acquiring infections will be very, very low. You have a very good question for the reusable mask. I can tell you that the reusable mask given by the government in June is actually very, very good. It's a cloth mask with a BFE of about 95 to 98%. That is actually a very good mask. The Temasek Foundation, I must admit I haven't collected mine, but from what I can see from the specifications, is quite good. And many of my patients who have worn it says it's actually very good. So to be fair, Zhenghu, the government, has given very good masks in June and July. So I like that very much. Yes, you can wash them again, and I would actually air dry it. For the cloth mask, I'm okay to sun dry. In fact, some people have pointed out that they are designed for sun drying. The government one, they actually write down that you can sun dry it. So if you can sun dry it, sun dry it. those reusable masks are quite good. I can't speak the same for the rest, which you buy from Louis Vuitton or anyone from the Cool 10 or the others. But before I use it, I will check the integrity, put it on, and check that the air breathes in through the cloth. Now, in theory, it is not as good as the surgical mask, and certainly nowhere close to the N95. But having some mask will help rather than no mask at all. Because you guys are listening into this, I have a hypothesis. Hypothesis, that means it's a belief, it's a scientific belief that's not proven yet. Do you realize that Singapore's mortality rate is very low? Do you realize that Hong Kong mortality rate, China's mortality rate after they put on the mask is very low? I think the severity of the infection is not dependent just on the age, but the amount of virus that goes through. So if you wear a mask and you kena the virus, the amount of virus that goes inside is actually very low. The disease that you end up with will be milder compared to the others. This is true for influenza. This is true for chickenpox. This is true for pertussis. And this is true for hand-foot-mouth disease. For many viruses and bacteria there are, the less virus that hits you, the less severe the disease. Which means get yourself a decent mask. If you kena the silly disease, as you end up the milder form of it, hopefully, and then you come out of it stronger going back to work.
Okay, great. Thanks, Dr. Leong. We still have got 5 minutes, so keep the questions coming, but we might not be able to answer everything. I'll just pick up from different industry to address some of them. So we have somebody from the music side. Is face shield good enough in a group music class with all 5 members blowing a wind instrument?
Cannot, Lam. You cannot, because the face shield, it can come up from the top, come down from the bottom, and certainly as you blow, you will aerosolize it, okay? So at this point in time, we're going to blow wind instruments through Zoom. I think that's better.
Okay, and then there's one more question for frontliners in hotels. Which face mask will be safer to use?
Hotel are a little bit different because a lot of them will look after the SHN. If money is less of a problem, I'll get them an N95 and I'll change it once a day. If money is a bit of a problem, I get a surgical mask that is checked. Mind you, staycations are now open. I'm trying to look for a staycation now. More staycation, more people, then the risk will be slightly higher. Best PPE for a receptionist, if the person doesn't mind wearing an N95, wear N95. If cannot wear an N95, wear a surgical mask with a face shield. That will be good protection.
Okay.
There are specifications for surgical masks. You can go and look at the slides. You can write into EastMed and get the specifications for surgical masks. There'll be no issue. Why does the government allow people to do strenuous without the mask? The simple answer is this. When you put on a mask, your oxygen inside your bloodstream will go down. This will be a stress on the heart. The person can die. Indeed, a person has actually developed heart attacks thereafter. So you are right. It is nonsensical. When I exercise, I go, I'm going to share my breath with everybody, and you are right, the virus can spread. So there are 2 ways around it. One is don't exercise. The 2 is everyone wear a mask, but that will trigger off unnecessary heart attacks. So the neutral ground thus is exercise and don't wear a mask. But when someone's breathing heavier, please go near the person. Don't go near the person. Okay, NAS actually need mask fitting procedure. By right, you need a mask fitting procedure. Speak to EastMed. If you're getting this mask, they can do the mask fitting for you. They'll make it very, very effective. For people who are working on the ground and interacting with visitors, again, the surgical mask is very good. Put on a face shield, and I think you are the best employer there is in Singapore. Which type of mask is better for schooling kids to use? The surgical or cloth mask? My surgical mask, I gave it to my son. Guess what? One day I can blow 3 or 5 because his snoot will come out and wet the whole thing. I really tak boleh tahan. So my wife actually made a sleeve for her, which is cloth. So we're using a cloth made mask for my son because his snot is so much. But in truth, kids get very mild illness. Even if the kids actually get infected, the chance of them spreading is very, very poor. Is there a difference between Everton say, is there a Nask mask and a KN95 mask? There is a difference. You have to try it to understand it. It's just like Louis Vuitton handbag is just a little bit better than some other unbranded handbag. Okay, for engineers who visit shipyards on board the vessels, N95 is actually good because you actually have different kinds of fumes and gases coming in. But again, comfort is one. Number two, remind them, many of them have very bad heart. Remind them, don't exert themselves. I would rather they wear N95 for their general protection, not so much a COVID-19 protection, than surgical masks. But again, warn them, do everything slowly and try not to kill themselves in the process. Should everyone present in the office has confirmed COVID-19 stay away from the office? Everyone, the moment you confirm COVID-19, they said 14, at least 21 days you're out of service, you can't go anywhere else. And for those people who came in contact with them, you should impose yourself a stay-home notice or quarantine order. Commuters allowed to come here a shopping mask, what PPE for MRT and public transport get packed again. Minimum surgical mask. Second layer, which is good, face shield. Okay, if you really can have it, N95, very good. N95 with face shield, super kiasu kiasi kiabo, you can't fall sick. Not with flu, not with COVID-19, not with chickenpox. So that is really very good. Face shield, you can use it as many times as possible until you can no longer see through it or see cracks on it, then get it changed. You encounter someone who's suspected of COVID-19, what protective gear? If you think the person really is at risk of COVID-19, I will wear a full PPE with my gown on and wear gloves, and I engage the person. Because suspect means the risk is much higher. If you have no choice, for example, you end up meeting the person and he vomited, okay, and you went to assist. Out of compassionate heart, you went to assist the person, etc. What you do is, throughout the whole episode, don't touch your face at all. When you're finished with the thing, wash your hands thoroughly with soap and water, get off all your clothes, have a proper shower, and then after that, then take off everything you have with clean hands. The moment you encounter someone who suspected COVID-19, you mustn't touch your mask or your face strictly at all. And thereafter, you have to wash and shower yourself and wash off everything. I think I've answered most of the questions. We are exceeded the time slightly.
So, Dr. Leong, just one last question that came in from the chat instead of Q&A. For a patient who goes for dialysis at the dialysis center, what is your recommendation of the PPE? Is N95 needed?
For the patient dialysis, for no need PPE, you wear a surgical mask, you wear a face shield, it's very, very good. If it's okay with a simple, nice and comfortable N95, that would be great as well. If you need the slides, I think it is okay for me to send it out, ask ESMAD about it. Will the pandemic pass? Yeah, the pandemic will pass, but the virus is here to stay. The virus will live with us for the rest of our lives. Okay, so next time, not only is there flu vaccine, but a COVID-19 vaccine. I've got this very good question. I'm going to try to answer. Is cleaning by UV light effective? Yeah, kind of. If the virus is not hiding underneath the light. UV light is only as good as when there's direct exposure for the virus or bacteria. If there's one dust particle here and there's one virus here, then the dust particle is protecting the virus, rendering it useless. So for that reason, I don't like UV light. So the Straits Times journalists who reported on this say this something better than nothing. So for that reason, I agree. Something is better than nothing. If you have UV light, use it, but be aware there are limitations. Henry Tan asked this question: why early stage not to wear masks? Was this a costly mistake? If I had it my way, I want everyone to wear masks at the very beginning. But in truth, there wasn't enough masks to go around. And you know the way the Jing Hu recommends is, if I give you a recommendation, I must have the ability to supply it. Okay, you can check back to the time when I did the interview in 91.3 SPH. The answer is, the risk of getting the infection then was very, very slim. There were only about 2 or 5 cases out of 6 million. And my answer then was, it's cheaper. The mask was more expensive than a Toto ticket. Okay, and the chance of getting COVID-19 then was much lower than Toto. In other words, you have a much higher chance of buying a Toto ticket and winning first prize than getting COVID-19. But as the disease went on, the number of cases went up. Then the utility of the mask was there. Mind you, we didn't put on the mask for 30 days. 30 days times 6 million people, that's 180 million masks. That's how many masks we saved when we didn't wear that 30 days. Agree? We ended up with an outbreak with foreign workers, but we saved ourselves quite a lot of masks. We had saved enough masks for the healthcare workers. If there were no masks for the healthcare workers, no masks for the hospitals all come crashing down. Our mortality is not 27 cases, but more like 27,000 people. Okay, I think anything else? That's about it.
Yes. Thank you very much, Dr. Leong. We have overrun about 5 minutes, but I'm pretty sure all the participants really value your opinion and your answers. So for those of you with questions that are not answered, we will try to see whether we can get back to you via email if we have those answers for you. So thank you very much for your time, Dr. Leong. And for participants who are looking to purchase PPE for your companies, we will be sending out a follow-up emails to see if there is anything that we can help with. So thank you once again for joining us today. Thank you very much, Dr. Leong, and have a good evening ahead, everyone.
Bye-bye.
Bye-bye.